So you might ask yourself, why visit a chiropodist rather than go to the nail salon? So a chiropodist is a foot specialist. We are members of a regulated health profession and members of the College of Chiropodists of Ontario. We must adhere to a code of ethics and standards of practice and rules and regulations that are set out by the college. This includes infection control directives that we have to adhere to. Chiropody is a 3-year diploma program in which admission is based on a Bachelor of Science in Health Sciences or a Bachelor of Art in Kinesiology. So you can see the chiropodist is well educated. We also have to have a certain amount of continuing education hours yearly in order to renew our license. So what to expect from a chiropodist? Seeing a chiropodist regularly can identify areas of concern that you might not be aware of and that the nail technician isn't trained to look for. Chiropodists are trained to assess circulation, assess neuropathy or nerve damage, and monitor that on an ongoing basis. We can identify footwear concerns and biomechanical issues, which means when you're walking, if you have increased pressures or pain in the foot, lower leg, knees, hips, etc., we can address that. We can look at why you're having a callus or a corn and get to the issue of how we can prevent it from coming back by trying to alleviate pressures or abnormal pressures so that wounds don't develop as well in the diabetic foot. We can also do soft tissue surgery, such as the removal permanently of an ingrown toenail. The chiropodist is also going to provide diabetic foot care education. We can recommend and measure and dispense compression stockings if you have swelling. We can prescribe orthotics if you have biomechanical issues and you need alignment to alleviate abnormal pressures and to take pain away from certain areas in the foot, knees, hips, etc. We can also recommend different products such as digital devices like wedges to try and separate toes if you're having overlapping toes or to try and straighten toes. We can recommend certain creams that are better than others for a diabetic. We can also prescribe and treat certain conditions that require medication. We can prescribe antibiotics if you have an infection. We can address fungal nails and fungal infections of the skin and other issues that require a prescription. There are prescriptions that we can write. So it is worth seeing the chiropodist for your peace of mind and to have that annual review and checkup if you are doing okay, just to monitor and make sure that nothing is getting worse and we don't see an area that might become problematic and that needs to be addressed. So book your appointment with an LMC Chiropodist today and we can assess and treat and make sure that you are putting your healthy best foot forward.